didn't seem to be getting better like a typical ear infection should. So I took him back to his local pediatrician, and the blood work that came back indicated and kind of had that typical presentation for someone who has leukemia.
Lincoln was diagnosed with acute B-cell lymphoblastic leukemia.
It's hard to really wrap your arms and thoughts around that, that was the news that you were going to get that day.
We have both come from large families, and nobody's ever had anything remotely like this.
In the grand scheme of cancer, B-cell ALL has a very good cure rate. The leukemia itself impacts your immune system, so Lincoln's ability to fight any type of infections was significantly decreased by this leukemia. The medications, the antibiotics they were giving him weren't helping, and he ended up becoming septic. And then he also started having this excruciating pain in his leg. They had lots of different specialists come in to look at him, and then it was finally diagnosed as necrotizing fasciitis, which essentially is a disease that eats away at the healthy flesh and your tissues in your body.
So between that and the chemo he was on, he was kind of looking at a pretty big uphill battle right away. Kind of went from one extreme where they think, oh, everything's fine, high success rate, to the other end of the spectrum in a hurry.
At that point in time, they didn't know how much the necrotizing fasciitis had affected his whole body. And, the surgeons felt at that point in time we had to make a decision. It was either keep Lincoln comfortable, knowing he would not survive. We had to try the surgery. We couldn't just not do anything.
You're sitting there in the PICU and there's nothing you can do for him. You're helpless.
So while he was in the pediatric ICU, he ended up having 11 total surgeries for the necrotizing fasciitis.
They took skin from his one leg and put it all over his other side of his leg.
Spent a lot of time talking with plastic surgery. Despite everything, the outcome was better than they had anticipated. So they initially thought perhaps 80% of his body, and it ended up just really being localized to that right leg and his abdomen. Looking back from a year ago, he's doing wonderful. When he left the hospital, he had 2 feedings. He was not able to walk. He was on IV medications at home for the infections. They didn't think that leg would be viable. And so to see him running and playing and doing the things that he loves to do is wonderful. This summer, he played t-ball with his friends.
The level of care at this hospital is above and beyond. Some of the nurses that were with Lincoln most of the time on the 11th floor will still come over to him when he's in here for treatment because they know he's here. Come over and say hi. He just lights up. He knows them by name.
So on Lincoln's case, we had orthopedics, we had general surgery, plastic surgery, palliative care, his oncology, urology, just a large number of disciplines. The collaboration within the many disciplines was wonderful. And even when we had questions about decisions, I felt like they always took the time to sit down and really listen to us.
When Lincoln comes here back to the hospital for his treatments, he feels very comfortable, very at home every time.
Lincoln's personality, he has a big personality, very energetic, full of life.
I really like to play with my brothers and sisters.
He goes to physical therapy twice a week and continues to get stronger and stronger. He has scars everywhere. It's just part of who he is. He's not self-conscious about it. It doesn't bother him. And so I hope that as he gets older that, he carries that same personality that he has now. He's definitely a fighter.
If Lincoln's care team, if I was to talk to them again, I don't know if thank you or a hug would be enough. This is truly a special place.